Hello, welcome to the Agni Nursing Academy. In the today's sessions, we are going to discuss about in detail about the growth and development. In these sessions, we will cover maximum for important in our upcoming examinations. We will cover in detail about growth and development. And these classes based on the previously asked MCQs, and the upcoming examination there is a chances to arise a question from this class. Okay, the growth means growth means it's a physical growth. We can measure that one is, for example, is weight and height. Development means there is a functional development occurs. It's a physiological development. We can't measure that one. And the growth is in the particular time period it will be stopped, but development it occurs that lifelong. Okay, the first MCQ on your display. A normally healthy child has a height of 100 centimeter and weight is 16 kg. What is the most likely age? Option A is 3 years, option B is 4 years, and option C is 5 years, and option D is 6 years. In the question is asked, the height is 100 centimeter and weight is 16 kg. What is the age? Like that is question asked. Okay, everyone know that one. Normal length of newborn is 50 centimeter. Is 50 centimeter. In the first year means the first 6 months, the height increases at the rate of 2 to 2.5 centimeter per month. 2 to 2.5 centimeter per month, and 7 to 12 months, the height increases at the rate of 1 to 1.5 centimeter per month. Okay, 1 to 1.5 centimeter in the 7 to 12 months of the age. There is the height at first year. In the first year means the height increases up to this 75 centimeter, and the 2 years age, means 90 centimeter, and the length doubles at 4 year. The length doubles at 4 year means the 50% means 100% of birth length increases at the 4 year of age, that is a 100 centimeter, and the length triples at the height triples at 12 years of age, that is 150 centimeter. 150 centimeter. Okay, means there is a formula for the height calculation. There is age between, means there is a formula for calculation of the height of the newborns or infants between 2 to 12 years of age. Only the 2 to 12 years of the age, that is formula is age in years into 6 plus 77. This formula is applicable for 2 to 12 years of the age children only. We can choose the height of we can calculate the height of the child. Okay, according to this we can give the directly answer for the option B, but weight also given. See here, normal Indian baby's weight, normal weight is 2.8 kg in Indian baby's weight, that one is 2.8 kg. The birth weight doubles at 5 months, means doubles at 5 months. Just you imagine that is the birth weight is the 3 kg, means 5 months it's doubles, means 3 kg means at 5 months 6 kg. At 1 year the birth weight is triples, means 9 kg, and the 2 years it is the 4 times. 4 times means how much it is? 12 kg, and in the 3 years of age it's a 5 times. 3 years of age it's a 5 times, means 15 kg. In the 3rd year the birth weight is the 15 kg, means 4, but height 100 centimeter at 4 years of age. Because of that's why we can give the answer for option B. The correct answer for our today's question, this question is option B is the correct answer for our question. Okay, we'll see the next question. See here, this one is the infantometer. We'll calculate the length. We'll see the length the child less than 2 years age. This one is we'll call it as an infantometer. This one will called as a recombinant length, and this one stadiometer. Stadiometer means we will calculate the height of children's, the age more than 2 years. The age is more than 2 years. The difference between recombinant length and stadiometer means standing length is 0.7 centimeter. 0.7 centimeter compared to the recombinant length, stadiometer standing length is less than stadiometer length, that is a 0.7 centimeter. Okay. See here MCQ. The weight of the child at 3 years is usually dash times of the birth weight. Means how many times? The question asked in the first MCQ only, I told you the weight of the child 3 years usually dash times of birth weight. Means at the 3 years of age, how many times it's increased, like that question asked. Option A is 3 times, option B is 4 times, and option C is 5 times, and option D is 7 times. In the first MCQ only, I told you there is at the age of the 3 years, the birth weight increased up to the 5 times of birth weight. Option C is the correct answer for our question. Okay, and see the next question now. Increase in height of the child from 1 year to 3 year, like that question asked. Means how much height increases in between the 1 year to 3 years, like that question asked. Option A is 10 centimeter, option B is 15 centimeter, option C is 20 centimeter, and option D is 25 centimeter. I told you that one at the first year height is 75 centimeter. 75 centimeters. Okay. At the 2 years of age, it's a 90 centimeter. Means how much up to the first to 2 years, how much increased? In between this one is the how much increase? Means 15 centimeter increase up to the 2 years of age. Means option A and option B, these two also not answer for our question. At the 4 years, I told you it's doubles, means 100 centimeter. Total how much increases? 25 centimeter. Between the first year to 4 year, there is a first year to 4, there is increase 25 centimeter. Means option D. But the age given up to the 1 to 3 years. Option D is also not correct answer for our question. Option A is also not correct answer for our question. Option B is also not correct answer for our question. Because of the age is given between the 1 year to 3 years. Means up to the 4 years, it's increasing 25 centimeter. We can't give the 25 centimeter. There is an answer for that one is between the 15 and 25 centimeter. Means the correct answer for our question is option C, that is 20 centimeter increases the height between the 1 year to 3 years of age. Option C is the correct answer for our question. Okay, let's see next MCQ. Premature fusion of coronal ethmoidal sutures is seen in spinofrontal and spinoethmoidal sutures. Okay, there is a premature fusion of sutures. What we will call if more than 2 and the premature sutures of more than 2 and single sutures, what we will call, like that question asked. Option A is tetracephaly, option B is dolichocephaly, option C is plagiocephaly, and option D is trigonocephaly. Okay, see here, premature fusion of sutures. There is a one premature fusion of sutures. That one will called as a craniosynostosis. That one will called as a craniosynostosis. If the sutures is premature fusion, that one called as a craniosynostosis. In the first class, I explained about the suture lines and the fontanelles also. If you want to watch, means if you want to know about the suture lines and the fontanelles, means watch the number 1 first class. Okay, if the premature fusion of, see here one by one we'll see the option here. Premature fusion of trigonocephaly means premature fusion of frontal sutures, or we'll call it as a, that one is a metopic sutures. That one will called as a trigonocephaly. Okay, plagiocephaly means premature fusion of, see here, plagiocephaly means premature fusion of lambdoidal sutures. lambdoidal sutures. Okay. Dolichocephaly, it is also called as scaphocephaly. It is also called as scaphocephaly. Means there is a premature fusion of sagittal sutures. That one will called as a dolichocephaly or scaphocephaly. Sagittal sutures. Okay. Tericephaly, it is also called as oxycephaly. It is also called as oxycephaly. Tericephaly means, see here, tericephaly means the closure of two or tericephaly, it is also called as oxycephaly. Premature closure of two or more suture lines. More sutures, that one will be called as a tericephaly or oxycephaly. In the question he is given that one premature fusion of coronal ethmoidal sutures and spinofrontal and the frontoethmoidal sutures given. Means in the question is there is a premature fusion more than two sutures. The correct answer for our question is option A. Option A is the correct answer for our question. That is a tericephaly. It is also called as oxycephaly is the correct answer for our question. We'll see the next question now. Earliest indication of sexual maturation in females. Option A is menarche, option B is thelarche, and option C is puberty, and option D is genital maturation. In the earliest, the visible sign of maturation means puberty in the females is thelarche. In the thelarche, what happened means there is a breast enlargement occurs. There is a sequence for that one. For sequence for maturation means secondary sexual characters. First one is the thelarche. In the thelarche, what will happen means the breast enlargement. Breast enlargement. The first visible sign in the sexual maturation in females means the correct answer for that one is the thelarche. After the thelarche, that one is the puberty. Puberty means in the puberty there is an onset of pubic hairs. Pubic hairs. After that one is growth spurt. Means growth spurt means there is a maximum development, means maximum the secondary sexual characteristics and increase in height and the building of muscles occurs. Maximum growth occurs in the growth spurt period. That's why it is growth spurt, will call that one. After that one is the menarche. Last one is the menarche. First visible sign is thelarche and the last sign is that one is the menarche. In the girls, the normal menses occur between the 10 to 14 years of age. 10 to 14 years of age. If occurs before 8 years, that one will called as a precocious puberty. If menses occurs after the 15 years of age, that one will called as a late puberty. Late puberty. Okay. And the menses occurs between the 10 to 14 years of age. The correct answer for our question is option B. Option B is the correct answer for our question. That is a thelarche. Okay. We'll see the next question. In boys, which is the first visible sign of puberty? Option A is in the boys his occurs. Which one is the visible sign of the puberty? Like that is asked a question. Option A is testicular enlargement. Option A is testicular enlargement. Option B is penile growth, and option C is breast hypertrophy, and option D is dark scrotum. In the boys, first visible sign here sequence is there. I will show you sequence. See here. In the males, there is the first visible sign is testicular enlargement. This one is the first visible sign, testicular enlargement, and last is the facial hairs. First testicular enlargement, after that penile enlargement, followed by that pubic hair growth, and growth spurt, I told you the maximum growth occurs in that particular period. That one is called as a growth spurt, and after that axillary hairs, after that facial hairs, and in the boys what will occur, there is a changes occurs in the boys when they will develop the secondary sexual characteristics. In that voices changes also occurs. And see here one image is there, this one will called as a orchidometer. Orchidometer means will assess the volume of the testis, assess the volume of testis, volume of testis. That one will called as a orchidometer. Okay, see here I told you which one is the first visible sign of in the boys is the testicular enlargement. That is correct answer for our question is option A is the correct answer for our question. That is testicular enlargement is the first visible sign in the boys. Okay, and the last visible sign, that is the facial hair growth. See here, we'll see the next now. Head circumference, we'll discuss about the head circumference. Head circumference normally at birth is 33 to 35 centimeter. Okay, the head circumference is at birth is 33 to 35 centimeter. In the first 6 months, means no, first 0 to 3 months, the head circumference increases at the rate of 2 centimeter per month. 2 centimeter per month. And the 3 to 6 months means 4 to 6 months. Okay, 4 to 6 months, the head circumference increases at the rate of 1 centimeter per month. 1 centimeter per month. And the head circumference increases from 7 to 12 months is 0.5 centimeter per month. Okay, 0.5 centimeter per month. Already I have discussed this one in the previous my MCQ classes. Okay, these the head circumference increases. At birth, head circumference is more than the chest circumference. The average head circumference increases. Average head circumference increases in the first year. Increases in first year at the rate of 1 centimeter per month. Head circumference increases, and the head circumference and chest circumference is equal at the age of 1 year. At the age of 1 year, and the head circumference and chest circumference equals at 1 year, and the chest circumference is always more than the head circumference after the 1 year of the age. Okay, this is about the head circumference. If the head circumference is less than -3 standard deviation, then that one will be called as a microcephaly. And if the head circumference is more than 2 standard deviation, that one will be called as a macrocephaly. Okay, this is about the head circumference and the chest circumference. Here mid-arm circumference. Mid-arm circumference at birth it's 12 centimeter. Through the mid-arm circumference we can assess the nutritional status of the child also. Okay, and mid-arm circumference will measured by the Sackett tape. Here Sackett tape is there. See, this one is the Sackett tape. There are 3 color coding. That one is red, yellow, and green. If the mid-arm circumference is more than 12 centimeter, more than 12.5 centimeter, means it's a green zone. Normal nutritional status. If the mid-arm circumference is between the 11.5 centimeter to 12.5 centimeter, means it's a yellow zone. Means that is a borderline nutritional deficiency occurs. If the mid-arm circumference is less than 11.5 centimeter, means there is a nutritional deficiency. severe malnutrition we will call it as. That one is a red zone. Red zone, the severe malnutrition. Here given this one is a red, yellow, and green. Okay. We'll measure the midterm circumference by the Sackey tape. There are three color coding. That one is a green zone, yellow zone, a red zone. We can measure the nutritional status of the newborn through the Sackey tape. Okay. This is about the midterm circumference. Here it is there. Upper segment to lower segment ratio in 3 years of the age child. In the question asked, upper segment and lower segment ratio at 3 years. How much in the ratio at the 3 years of the age? Like that he asked the question. Option A is 1.2:1, option B is 1.3:1, and option C is 1.4:1, and option D is 1.6:1. Okay, see here image is there. From the head to pubic symphysis, we'll consider that one is the upper segment ratio, upper segment length, and from symphysis pubis to heels, that one we'll consider as a lower segment length. At birth, upper segment and lower segment ratio is 1:1.7 to 1.9:1 at birth, and at the age of 3 years, the upper segment and lower segment ratio is 1.3:1, and at the 7 years, means 7 to 10 years, the upper segment and lower segment ratio is 1.1:1. It's equals at the age of 7 to 10 years, the upper segment and lower segment ratio is equal. If the upper segment and lower segment ratio decreases, means that one will called as a short trunk dwarfism. This will help in the short structure. If the upper segment and lower segment ratio increases, that one will called as a short limb dwarfism. We'll call that one. Always there is a defect occurs in the lower segment ratio. If there is a denominator is lower segment ratio, the result is ratio is depends on the lower segment length. Okay, the correct answer for our question is, in the 3 years of age, I told you here 1.3:1. The correct answer for our question is option B is the correct answer for our question. Okay, let's see the next question now. See here, what is the probable age of this baby? See the image and ask us the age of the baby and comment in the comment box. Okay, option A is 2 weeks, option B is 6 weeks, and option C is 3 months, and option D is 4 months. Here child is in ventral surface, means the child is ventral surface, and the head is, this one we can call it as a horizontal line. The head is above the horizontal line. The child's head is above the horizontal line, and if the child head is below horizontal line, at the horizontal line, the head correct at the horizontal line, means ventral suspension, at the body in rest position at the 4 weeks, means at the age of 4 weeks, the child's head at the ventral suspension level. If the head of the child is above the horizontal line at 12 weeks, and below the horizontal line, that is in the 6 weeks. In the question asked and the image it is there, the head of the child is above the horizontal line, means 12 weeks. 12 weeks means 1 month is equal to 4 weeks. Here the option given is 3 months. Option C is the correct answer for our question. That is 3 months of age, the child head is above the horizontal line at the 12 weeks of the age, or it is also called as 3 months. Okay, we'll see the next question now. What is the sequence in which of the following milestones are attained? Here, see the images and answer the question. Okay, see the option also. Which one is the first? The sequence asked in the questions. In the question asked according to image sequence. Option A is A, after that B, C and D. Option B is D, C, B, A, and option C is D, afterwards C, A and B, and option D is D, B and C, A. I will give the option. This one is A, consider, and this one is A, and this one is B, C, and this one is D. Now you arrange the sequence according to the age. Which milestones occurs earliest and late? Like that. Arrange according to the sequence like that question asked. Now we will see one by one. In the first image, what is given? The child is walking with support. The child is walking with support. Okay. Walking with support. When child walks with supports means at the age of 12 months. At the age of 12 months. And here the B image is the child is creeping upstairs. Its milestone attained at the age of 15 months. 15 months. Creeping upstairs at the age of the 15 months. And see the C image. Child is sitting with support. Child is sitting with support. When it is attained, when it develops means at the age of 6 months, the child can able to sit with the support at the age of 6 months. And see here the D image, child's foot is in mouth. The child is taking food is in mouth. Its feet in mouth. It develops at the age of 5 months. At the age of 5 months. Now we will arrange the sequence. This one is the first image is develops at 12 months, that is walking with support, and that is a B image that is develops at 15 years of the age and sitting with support at 6 months, and feet in mouth it's at the age of 5 months. Okay, means first milestone develops at D, feet in mouth, afterwards C at 6 months, after that one is develops A, the child is walking with support, afterwards option B. Okay, correct answer for our question D followed by C and A and B. Options D, C, A, B means option C is the correct answer for our question. Option C is the correct answer for our question, that is D, C, A, B. Okay, correct answer for our question. See the photogram memory, it's very helpful to remembering. That's why I added the image based MCQs. Okay, see here. A child is draws triangle at what age? Means triangle means this one is the triangle. At what age child is draw? Like that question asked. Here at the what age child is able to draw the triangle, like that question is asked. Option A is 2 years, and option B is 3 years, and option C is 4 years, and option D is 5 years. See here, the child is able to draw line, straight line. Child is able to draw straight line. How much ends are there? 2 ends. Means the 2-year child is able to draw the straight line. Okay, straight line. Here one image is there, we'll take here and we'll discuss that one. See here, this one is a circle, this one is a circle, and if the child, this one is looking like ears, that one is the look like a tree. The child is able to draw this circle, at the age of 3 years, at the age of 3 years, and the child is able to draw the, this one is a rectangle, this one is a rectangle, means child is able to draw rectangle at the age of 3.5 years, at the age of 3.5 years. Okay, and this one is the, this one is the square. Okay, in the question asked, there is a chance to ask rectangle or square. We can give the answer, that is a 4 years. Square able to draw at the 4 years of age, 4 years of the age. See here, this one is the triangle. Imagine, this one is the triangle. The triangle is able to draw at the age of 5 years. At the age of 5 years, child is able to draw the triangle, and these two are diamonds. It's a difficulty to draw, means child is able to draw diamond at 6 years of age. I think we have covered that everything. The child is able to draw straight line at the age of 2 years. We can easily remember that one because of the straight line is having two ends. The child is able to draw at 2 years, and this one is a square, that one child is having, the square is having four verticals, the four corners. We can easily remember that one at the age of 4 years. And triangle is difficult to draw compared to the square, that one able to draw at the 5 years of age, and the child is able to draw diamond at the 6 years of the age. The correct answer for our question, in the question is asked triangle. Triangle we can draw, the child is able to draw at the age of the 5 years. The correct answer for our question is option D. Option D is the correct answer for our question. The child is able to draw triangle at the age of the 5 years. Okay, let's see the next question now. A baby can follow the object till 180 degree. See here question, the baby can follow the object till 180 degree, can hold the neck, can sit with support. The child is able to follow the object at 180 degree, means fully 180 degree child is able to follow the object and able to hold the neck also, and can sit with support, but cannot sit with support. The child is sitting with support but not able to sit without the support. What the age of the baby, like that question asked. Option A is 1 month, option B is 3 months, option C is 6 months, and option D is 8 months. We'll see here one by one. Here one by one. Here the child is able to follow the object at the age of, child is able to follow the object in 180 degree at the age of 8 to 12 weeks. 8 to 12 weeks, and child is able to hold the neck, that one is the 12 weeks, means 3 months. 3 months, or we can call this one is a 2 to 3 months. The child is able to follow the object in the till 180 degree. Okay, and the child is able to hold neck, means neck holding capacity develops at the age of 3 months, and child will sitting with support. The previous MCQ only we discussed, the child is able to sitting with support at the age of 6 months. Age of 6 months, but cannot sit without support. Child is able to sitting without support at the age of 8 months. Sitting without support at the age of 8 months. But in the question he is told that one is a child is not able to sit without support. Child is sitting with support, means at the age of 6 months. According to that one, the correct answer for our question is option C, that is a 6 month, means 6 month child can able to follow 180 degree object and hold the neck and sitting with support. The correct answer for our question is 6 months is the correct answer for our question. Okay, that is a 6 month. We'll see the next question now. Okay. Child can make a 3 cube tower at the age of, means the child is able to make 3 cube, this one is cube, the child is able to make 3 cube tower, like that question asked. Child is able to, the child is able to, there is able to make a tower of 3 cubes, question asked. At the age of 15 months, at the age of 15 months, child is able to draw the the child is able to draw the 3 to 4 cubes tower. And the 18 months, means there is at the 24 months, the child is able to draw the, there is a 6 to 7 cubes tower. And at the age of 36 months, means this one will count as a 2 year, 24 months equal to 2 year, and 36 months it is a 3 year, child is able to draw 9 to 10 cubes towers, 10 cube towers. Okay, if you are remembering this one, because of this is the values, there is a no tricks for remembering that one. We have to remember that one. The correct answer for our question, the child is able to draw, means 36 months, at the age of there is a 9 to 10 cubes. Okay, and the 24 months 6 to 7 cubes tower, and the 20 means between the 16 to 20 there is a chances to draw the 4 to 6 cubes or 5 to 6 cubes child can draw. And at the age of 16 months child is able to draw, that able to make, that one is the tower of 3 cubes. The correct answer for our question is option, this one, actually option, this one is a B and this one is a C. Okay, option C is the correct answer for our question. That is a 16 months baby can make the 3 cube tower at the age of, make 3 cube towers at the age of 16 months. Okay, let's see the next question now. In the question, a 8-week infant, means 8 week means 2 months. Okay, 8-week infant can do all the following. This one is the select that all that apply question, all the following except, in the question asked the 8-week infant can do all the following except, means which all follows the things the child will do at the age of 2 months, and which is not able to do, which is not able to do, like that question is asked. We'll see here, in the previous question only, there is all MCQs are interlinked only. Okay, in the previous MCQ we discussed, child is able to develop the head control at the age of 3 months. The previous question only I told you, head controls means neck control develops at the age of 3 months, and I told you lift his head up to the horizontal line, means there is correct at the ventral suspension, the rest body condition, the child is able to, in the ventral suspension, child is lift the head up to the ventral suspension. I told you that develops at the age of 4 weeks, means 8-week child can able to lift the head up to the horizontal line in ventral suspension. Okay, child follow the red object up to the 1 degree. I told you that one, the 1 degree 180 degree child is able to follow object between the 8 to 12 weeks, 8 to 12 weeks. And the social smile, the social smile develops at the age of 2 months. The social smile develops at the age of 2 months. But see here, the fourth one is child turns the head towards the sound. The child turn head towards the sound at the age of 4 months, and head control develops at 3 months. But in the question is asked, which all are those things develop in the 8 weeks of the child, and which all are not develops in the age of 2-month-old infant, like that, ask this one question. The correct answer for our question, this is select all that apply SATA question, option A and option E. Option A and option E is the correct answer for our question, that is head control and turn head towards the sound. Okay, the A and E is the correct answer for our question. We'll see the next question now. A 2-year-old child, can do, means the 2 years child what can be able to do, like that question asked. Option A is can ride the tricycle. Option B is climb up and down stair with one step each time, means the each times the stuff is, see here I will show you the image also. And option C is knows his sex and age, and option D is handles spoon well, and option E is can read story with pictures. We'll see one by one. The child develops and can read. The child develops and can read the story with the pictures. It develops at the age of 4 to 5 years. It develops at the 4 to 5 years. And child can able to handle spoon at the age of 18 months. At the age of 18 months. And child is knows his sex and the name and age at the age of 3 years. 3 years. And the child is able to climb downstairs with single step at the age of 18 months. The age of 18 months. And in the previous MCQ also we discussed that is creeping upstairs develops at the age of 15 years. And the climbing up and downstairs with one step each time, it develops at the 18 months. And child can ride the tricycle at the age of 3 years. At the age of 3 years. But in the question is given 2 years old child. See here image. This one is a riding tricycle, develops at 3 years, and spoon handling develops at 18 months. This one is the child climbing upstairs with single step. It develops at 18 months of age. The correct answer for our question, this one will select that all that apply. The child is able to climb up and down stairs with the one step each time. Option A and option D. Option A and option D is the correct answer for our question. That is option B and option D is the correct answer for our question. That is a climb up and down stairs with one step each time, and the child is able to handle the spoon at 18 months. Option B and option D is the correct answer for our question. Child can able to handle the spoon at the 18 month of the child, and can ride the tricycle at 3 years age, and child is knows his age and sex at the age of 3 years, and can read the story with pictures. It develops at the 4 to 5 years of the age. Okay, I think we have covered everything. Almost all we are covering that is important in our upcoming exams. We'll see the next question now. See here, a 3 month, the child age is given 3 month, baby can do 3 months, or can called as that one is 12 weeks also. The every MCQ is interrelated to previous MCQ in this session. Okay, the social smile develops at 2 months. The option A is social smile, and option B is can sit with support. Option D is C is transfer the object from right to left, and option D is hold his neck, and option E is can change the position from prone to supine. Okay, we'll see in the 3 month child what can be able to do, like that question is asked. Okay, see here, first one is a social smile. Social smile is developed at the age of the 2 months. And option B, child is can sit with support. Its previous MCQ only 2 times it came covered, that develops at the age of 6 months. And there is a transfer of object from one hand to the another hand. It develops at the age of 7 months. It develops at the age of 7 months. And child is means head control. Head control when it develops at the age of 3 months. At the age of 3 months, head control develops. And the child is able to change the position from prone to supine means this one is rollover. Rollover from prone to supine, it develops at the age of 6 months, 6 months, and supine to prone develops at age of 7 months. In the question asked, 3-month-old child, what can be able to do? The correct answer for our question, 3 months means child is able to do social sign. Social sign means option A is also correct answer, and child is able to hold the neck. Option D is the correct answer. Option A and option D is the correct answer for our question. That when child is can change, child is can hold the neck, and child is able to do social smile. This is the correct milestone at the age of 3 months old child. Okay, we'll see the next question now. See here. A boy can grasp the rattle, and recently he is able to transfer the object from one hand to the another hand, and he should also be able to do. Means child is grasping rattle. Means pincer grasp. Means this one will called as a rattle. This one will called as a rattle. Child is able to grasp this one rattle also, and child is able to transfer the object from one hand to the another hand. What child can able to do? This age child, what other things can able to do? Like that question asked, child is grasping rattle and able to transfer object from one hand to the another hand, and what able to do in this age? Like that question is asked. Option A is babbles, option C is sit with support, option B is either, one second, this one is option B, option B, and this one is option C. Okay, option A is babble, option B is sit with support, and option C is say mama and dada, and option D is stand with support, and option E is able to walk. Okay, see here, you'll see the option one by one. Babble means child can able to use monosyllables. First we'll see in grasp, the child is able to grasp the rattle, means child is able to hold, and child is able to transfer the object from one hand to the another man. Means I told you that one in the previous MCQ, at the 7 months of age child is able to grasp the object. Okay, and this one is the can grasp the rattle. Can grasp the rattle means it develops at the 8th month of the age. Okay, babbles means monosyllables. Monosyllables child can able to use, it develops at 6 months of age. 6 months of age, that one is ma and da, and child is able to sit with support, sit with support at 6 months, and option C is say mama and da, that is bisyllables. Bisyllables, it develops at the age of 9 months, and stand with support, the child is able to, means child is sitting with support 6 months, sitting without support at the age of 8 months, and child is able to stand with support 9 months, and standing without support at the age of 12 months. Okay, stand with support means it's a 9 months, and child is able to walk with support, child is able to walk at the 12 months of age, and child is able to walk without support, without support at the age of 15 months. Age of 15 months. What can do in this age? Like the question asked, means maximum age is 8 months. The correct answer for our question, option A, child can, it's developed at the 6 months of age, child can sit with support. The option A and option B is the correct answer for our question. Child is able to use monosyllable and sitting with support. Okay, Option A and B is the correct answer for our question. We'll see the next question now. A 10-month-old child cannot do. The question asked, 10-month-old child cannot do, because so many are students that doing the mistakes in the exams because of like these lines are, they will not focus. We have to focus always in the question last something they mention, except otherwise cannot. In the question asked, 10-month-old child what cannot be able to do, like that question asked. We'll see option one by one. Change cube from one hand to the another, means child is able to exchanging object from one hand to the another hand, and child can build a tower of 6 cubes. I told you the tower of 6 cubes, the child can able to build a tower of 6 cubes at the age of 24 months, means 2 years, 24 months, and can pull to stand, means the child is able to standing with support. The child is able to standing with supports at the 9 months of the age, can speak sentence of 4 to 5 words. The child is able to speak sentence of 4 to 5 words that develops at the age of 2 years. Okay, and the child is, and option E is, that's a pincer grasp, means grasp, pincer grasp reflex develops at the age of 9 months. Okay, which is not able to do, like that question. This one develops at the first one is the child is able to change cube from one hand to the another, develops at the 7 months, like that I told in the previous MCQs also. But in the question asked, which is not able to do, 10 months old child. See here, option B, child is not able to build a tower of 6 cubes because it's developed at the age of 24 months and can speak the sentence of 4 to 5 words. It develops at the age of 2 years. The option B and option D is the correct answer for our question. The child is not able to do, child is not, cannot be speak sentence of 4 to 5 words. Okay, 10-month-old child cannot speak 4 to 5 words sentence, but the 10-month-old child can use the words with meaning at 2 to 3 words, 2 to 3 words with meaning, it develops at the age of 12 months. It develops at the age of 12 months, child can able to use. Okay, see here, what the option B and option D is the correct answer for our question. We'll see the next question now. At the 18-month-old child, infant can do all except C. 18 months child can do all. In the option given, child is able to do all, but which is not able to do, like that question is asked. Option we'll see one by one. Option A is climbing upstairs. Option B is can follow the mother activities, and option C is can turn 2 to 3 pages at a time. Okay, child is able to turn pages at the 2 to 3 pages at a time and can say 2 to 3 words, and option E is can make a tower of 8 cubes. Okay, see here, option A, climbing upstairs. Yes, the climbing upstairs develops at the age of 18 months. Okay, and follow the mother's activity, means domestic mimicry. The child is follows the mother activities. Mimicry develops at the age of 18 months, and child is able to turn the pages 2 to 3 pages, develops at the age of 18 months. 18 months, and child can say 2 to 3 words at 12 months. And can make a tower of 8 cubes, like that question asked. the child is able to make a tower of 8 cubes, means at the age of 24 months. The child able to build a tower of 8 cubes at the age of 24 months. For answer for our correct answer for our question is option E. Option E is the correct answer for our question, that a child is not able to do at the 18 month of age. Child is cannot able to make a tower of 8 cubes. Option E is the correct answer for our question. Okay, we'll see next question now. A child can do all the following activities. What is the approximate age? See here, image given. These images given, in what age child can do like that question asked. Option A is 2 years, option C is 4 years, and option B is 4 years, and option C is 3 years, and option D is 5 years. See here, this one is the option B, this one is the option C. There is a typing mistake occurs, adjust with that one. Option A 2 years, option B is 4 years, option C is 3 years, and option D is 5 years. We'll see the image here. This one child is putting a shirt buttons, means buttoning. The buttoning develops at the age of 4 years, and the child ties the shoelaces at the age of 5 years. At the age of 5 years, child is able to tie the shoelaces. The correct answer for our question is option D is the correct answer for our question. The 5-year child is able to do the child is able to put shirt buttons, and child is able to tie the shoes laces at the age of 5 years. Okay, now we'll see the next question. See here, what is the sequence in which the following milestones? In the image given, which sequences occurs like that question is asked. Okay, option A, first we will give the image A1, this one, image B, image C, and this one is the image D. Okay, option A is first appears A, afterwards B, C, and D. Option B is D occurs first, after followed by C, B, and the A. And option C is the A occurs first, afterwards D, and afterwards that one is a B and C. And option D is first occurs C, followed by D and B and A. Like that option given. You'll see the images here. What things are given in the image? The child is playing a mirror. The child is seeing a mirror and playing that one. Mirror playing develops at the age of 6 months. Mirror playing develops at the age of 6 months. And image B is that is the child is showing a, that one will call it as a peekaboo. Playing peekaboo develops at the age of 10 months. And MSC1, the child is kissing mother on the request. Kisses on request. On request, it develops at the age of 12 months. And the child is saying bye-bye. Child is saying bye-bye. Waves a bye-bye at the age of 9 months. At the age of 9 months. Okay, we'll see here which one develops first. See here, the image A is develops first. A, afterwards D. The child is start to wave bye bye. and afterwards that one is the B, last one is the C. Okay, correct answer for our question is option C is the correct answer for our question. First child will develops mirror playing at the age of 6 months, followed by that one is the child start to wave a bye bye at the age of 9 months. After that one is the that image B, peek a boo at the develops at the age of 10 months, and child is start to kisses on request, it develops at the age of 12 months. Option C is the correct answer for our question. Okay, see here other important milestones we have covered here. See, this one is the image and founded. This one is the traveling. This one is the tripping. Means in the traveling, the child's stomach, abdominal cavity, it touches the surfaces. Child is able to moving forward with the supports of abdomen. The abdomen touches to the surfaces. It's developed at the age of 8 months. Traveling. A first, E after. The child develops first traveling. After, at the age of 10 months, child develops cripping. In the cripping childs, with the help of means there is no touches abdominal cavity to the surface. Okay, that means the cripping develops at the age of 10 months. The child develops stranger anxiety at the age of 6 months, and the child is able to use 2 to 3 words with a meaning at the age of 12 months. 12 months, and child is able to scribbles, means child able to scratch, like that child is able to scratch, that one will be called as a scribbles. Develops at the age of 15 months. Develops at the age of 15 months. 10 words with meaning, the child is able to use the 10 words with a meaning at the age of 18 months. At the age of 18 months, and child is able to means the door knob will be there na, child is able to turn the door knob at the age of 24 months. 24 months, and child is able to kick the ball at the age of 24 months. This one in the last, that PGI Sangrur exam asked, PGI Sangrur 2025, in that exam milestone, this one given, kick a ball develops at what age, like that question asked. For that question, correct answer is 2 year or 24 months is the correct answer. Okay, in the last PGA 2025 question is asked. Eyeball follow the object. The child is able to follow the object at 45 degree. At 45 degree, once the 45 degree only child is able to see, that one develops at birth only, it will be present up to the child is able to follow the object up to the 45 degree. That one develops at the birth only. At birth only it's develops. The child is able to follow the object up to the 90 degree, means child is able to follow the only up to the 90 degree, means straight line. The eyeballs turns up to the 90 degree. This develops at the age of 4 weeks. 4 weeks or 1 month. Okay, and child is able to follow the object up to the 180 degree, develops at the age of 2 to 12 weeks. Sorry, 8 to 12 weeks means 2 to 3 months. Child is able to follow the object up to the 180 degree, that one will called as a develops at the age of 2 to 3 months of age. Child is able to follow the object up to the 180 degree. I think I have covered maximum growth and normal growth and development. Okay, just that other maximum, there is a chances to ask in the upcoming examination. I have covered maximum. Okay, thank you so much. We'll see in the next class.